Sounds good.
No,
Okay.
that's perfectly okay. For me, you're absolutely right, Amy. If we, we're an in-person meeting, it's not an issue to have a snack or have your lunch or whatever it may
Right.
be. But when I can see myself eating on the
Terrible.
video, that's why I'm like,
And
when I
very
can see
shortly, we're
my-
gonna like share screen, and then you don't even have to see your own face if you don't want.
Right.
So you can eat in oblivion. We'll never know.
And usually I adjust it to go to speaker mode. So it's just, it won't be a big deal. So,
No, it's fine.
yeah, I know. It's funny. And I do, like, even in Zoom meetings, I think it's hard because so many times I'll say something in a regular meeting and I'll see this and I can address that, like, okay, this isn't connecting with you. And then we can kind of work it out. I can't see that when we're doing Zoom meetings. So if you want to head,
You have to make a grunt. If you do like a head, like if you could grunt or something, that would be helpful. We'll address it.
We'll go, what?
Yes, please do that. We encourage it.
okay. Yeah, no, I do. Okay. So let me do some screen share here if I can. Y'all probably know me, but I am Amy Forrest with a consultant with the Jackson Collaborative at Work, and Sarah Willis, also a consultant. And
Yeah.
then
I was gonna say, I'm Sarah Williams. Yes, I'm a partner in crime. And I can't remember if like we've met, or if I just know your name. Will you remind me your agency you work in?
I am at the health department here in Jackson
Oh, okay.
County, and Amy and I used to be co-workers when she was with our FEMA program doing health education, and I oversee like our personal and preventative health and the community health coordinator. So fetal infant mortality review, children's special health care led early on in maternal infant health.
Great. Thanks for introducing yourself officially anyway. Nancy,
Absolutely.
hello again. And I do know you, and I'm glad you're here, but I don't want you to feel left out that I didn't call you out.
No, that's okay. Ian, I think we've met before, but I'm with the College and Career Access Center.
I have your name written down to contact to do a presentation at one of my staff meetings. I'm so
Awesome.
glad.
Oh, that's great. Our community initiatives coordinating team members are going to be so excited because they have a goal of hitting 4 new places this fall and 4 in the spring to present on what we do or do a workshop. So they have one, and they'll be so happy to hear that you want someone else. So
Yes,
I'm happy.
absolutely.
I'm always happy to come out too. I can come out too. But Brian Green and Mary Rodriguez, they do an amazing job. But yeah, if you want me to come out, I'm happy to come out too. Whomever.
It doesn't matter to me. Just
Okay.
a Zoom, we'd meet through Zoom. So it would be a very efficient way to do some outreach. but
Yeah, let's do it. Let's get it scheduled.
Awesome. Sorry.
no worries. This is, hey,
Sidebar.
How
this is
dare you?
part of it. We'll get through these slides.
Yeah.
And I'm sorry, I should know this, but Nancy or Ian, have you guys been to any of the other affinity groups?
Would ask me that. I think
I was
I
gonna
know.
say, Nancy
See?
may have.
I know my
May
team members have, a couple of them have, and I think that this is the only one that my goal was to get to each one to see which one I felt that
Yeah.
me personally was a good fit. But I remember this one specifically. I've only been to one, and I think that this is the one because it was service system suck was in my head. As
That
one
was
of
this
the-
Oh
one.
my gosh,
Okay.
we
Yep.
did talk about
We did
that.
talk
I'm so
about
glad
that.
that was the takeaway that you got from
Oh,
that.
that was my takeaway. The service system.
No, wasn't
suck.
it? Wasn't it? The goal was to make them suck less.
Yeah, make them suck less. I thought it was great. I was like, this is my group. So
That's what we're
I haven't
about.
I haven't been to any other ones. This is only one, and it was a few months ago. I think it was your first one.
I think
Okay.
it was.
Okay,
That-
awesome. So we will
Shockingly,
go-
that wording has not made it into like the year-end deliverables or the work plan. I can't believe it hasn't made it, but maybe soon we'll get there.
I think it should.
Yeah,
think it might.
suck less is strength based, right? You
Right.
know?
Suck less.
Yeah, that's strength based.
It's like progress, right?
Yeah.
Like,
It is,
yeah.
you know, that's the goal, right? I mean,
Right.
we call it like it is. We don't beat around the bush in these kind of things. We call
That's
things
right.
out and,
Oh my gosh.
okay. So we are going to do a little bit of background, just to make sure everyone's on the same page. And I apologize if you've gone through this. But a lot of people are still kind of like, what is this affinity group thing all about? And what's the purpose of them? So they are really about building capacity, supporting conversations, so that people, that was the wrong slide. To move to action, to make service systems suck less, with an emphasis on those experiencing inequitable outcomes. So really we are all working toward that same goal. And this is, we're hoping to give you tools to help do that in a better, stronger way. And then make connections. But the focus, like we always talk about, disaggregating data to make sure that those that are experiencing less inequitable outcomes are really the ones we're gearing up toward or kind of supporting. So it is focused on partnering with other community members. We know that as larger groups, we are stronger when we're building off of each other, and really not just other community members, but really with people who have lived experience, so that we really understand what the deep root causes are. So many times we sit in our meeting rooms and talk about, well, let's do this and let's do that. And it's really not even just asking folks what they need, but really building relationships so that they have that trust with service providers to make sure that they are telling us what they need. People know, folks know what they need. We just don't tend to listen. And then those relationships, we always talk about people know what they need, and we can't just go out with a clipboard and say, what do you need? How can we make it, easier to navigate these service systems, but have them be part of the solution. So when we're building strategies in our organizations and when we're talking about tackling these root causes that are very difficult, they need folks that are experiencing those barriers need to be part of the solution. And then obviously moving to action. So building strategies, we have tools and resources that can help build strong strategies that address multiple root causes. And we have a lot of different worksheets that can help you build strong strategies. And it's about pushing people to move to action. So we sit around, and we've done this for a lot, talked about like, this is a problem and this is really difficult for people to understand, and the process to get through this service system is really, really difficult. And so we are here to push people, like, what are you going to do about it? How are you going to make this different? What are actionable steps that we can do instead of just talking about the problem and going back to work? These are really designed to kind of come together and say, what are the real barriers and what are things that each organization can do? And then ideally, in an ideal world, the Affinity group will have a series of strategies the group won't have it. Organizations will have strategies that we can kind of pull together. Sarah and I will pull together to say, yes, these are the things we've implemented, and we are moving the needle on making service systems easier to navigate. Sarah and I are here really to support activities, help make connections, help get you speakers for your next staff meeting. And like I said, share resources and provide technical assistance. So you guys are the doers. You are the people on the front lines. You are the ones taking action, and we're just kind of here to help support all of that work and give tools or help you think deeper. And we will ask the hard questions when you come up with a strategy and you say, this is what we're going to do. We're going to stop and step in and say, well, how do you know that's the right thing to do? Who did you talk to? Who is this really going to affect? Are there unintended consequences? Who will be affected negatively by this strategy? So we're going to push, we're going to dig deep, and then hopefully we're going to change the world one strategy at a time. Any questions?
That was a very good summary.
Yeah, that was
Go
great.
ahead.
It's a lot of deep stuff in one elevator speech.
I know, but and we try to simplify it because the network uses way too much jargon. We've heard it,
Yeah.
we know it. I don't like it. So we're kind of like, let's just boil this down and kind of talk about what the intent is. The frou-frou language doesn't work for me. So, so we kind of move it.
I went and I took part in the collective. There's been collective impact, like state collective impact. I don't know if you sent it to me or you guys sent it to me or Sherry. I don't know who sent it to me, but there was a conference and it was great.
Awesome. Yeah.
And one of the things that they talked about in there was just making the language. I mean, because otherwise it's like it totally defeats the purpose when you don't make the language something understandable, because then who can understand it? Like,
right.
And become involved in the movement.
Right. It is hard and it's intimidating. I mean, I know my role at the health department, I was a network member or a partner, and kind of dabbled in a couple of different of the work groups. And sometimes when I would get things from the network, I would be like, too much. and I'd go on to the next email.
Right,
So
right.
we
right.
understand that it's confusing, and we are like, we do have the technical expertise, but we try to like make it more relatable so that people can jump in and kind of work together. So,
And I love in the reminders, like the constant communication, because I'm like, God, which root cause are we working on? I'm like, geez, I mean, like the fact that, you bring it up a lot, it reinforces it. And then the alignment, like with the Jackson Community Foundation grant, like
Yep.
this last year and this year, I thought that was cool. Cause then you're like, oh, this has something to do with something we're doing in the collaborative network, So anyway.
yeah,
Yeah,
we're all
there-
working towards the
that-
same thing.
I was gonna say, yeah, that actually like coincidentally, but not, right? Like they're, especially this coming round of funding is, yeah, their 3 root cause or whatever match up with our affinity groups. And so we're actually, going to be presenting at their next meeting and offering like support and like here's how all of it aligns. And, yeah, but to your point, Nancy, and what we were saying, Amy was saying too, around like, the truth is that we're doing systems work, but if you say like, hey, tell me your system change strategy, like there can be a glaze over because it sounds really like a lot and overwhelming, and I might not give the right answer, kind of thing. And so Amy and I hope to be like translators a bit, and also like, oh, wow, you helped, Nancy made this policy easier for people to fill out paperwork. Like, oh, actually, that is a systems change thing. And why did you do that? And then like, who did you talk to? How did you know it was a problem? Right. And so we're trying to like be the in-betweeners,
Yeah, like backwards map it almost, like go in and like see what they're doing and then name it. Like,
Well, that's
you guys
why
name it.
That's right. And that's why we're hoping that all of you will come. That's why we're hoping to have these groups, because even if you don't have something flushed out, or we're trying to make it very clear that you don't have to have a whole action plan when arriving here. Like are you doing work around trying to navigate, helping people better navigate systems? And you're like, oh yeah, I'm doing that. And then if you were to say, well, here's this thing I'm doing. And like, then we start having a conversation around it. Like, oh, that's so interesting. Like, why did you decide to do that? And then you're going to be like, well, I don't know, because Bob from 40 years ago told me I should. I'm like, well, maybe, and so like, there's a whole conversation around it. And before you know it, you have these strong strategies that are like tied in. You don't even have to know the words that we're using behind the scenes. Right. But like that you're actually, then we're all moving the needle together.
Yep.
Yeah. And I think
you're like the organizational psychologist. So that's what you should call it. We're your organizational psychologist.
Do you think that would attract people?
Who's going to come to an organizational psychologist?
Well,
we're just cool people to hang out with, and we like to chat with people, and we love the work that we're doing, and we want to make our community a better place. So come hang out with us.
I'm an organizational social worker, actually.
Well, but the people don't have to come to you with the answers. They come to you with their problems,
their intent. Yeah.
And we just bring up questions.
And that you help to prescribe. I don't know. Anyway, go ahead.
No, that's it. And I think that's the whole shift of the way that the network is kind of moving, is that we used to be like, oh, health and education, and we were siloed. Everyone was doing amazing work, and sitting on the collaborative, chairing the collaborative council with Monica, I was like, we can't possibly connect all of the work that we're doing because everyone's doing awesome work. So that's why we kind of shifted to be like, let's start with like the real deep causes, like the real deep barriers. Like people can't navigate systems. People don't trust service systems, like some of those things. And then folks from all sectors can come together and we'll really organize the work around the problem, not around the work that you're doing. So it's been kind of cool. Okay, so why should you bother coming or connecting? So these are kind of what we're hoping you get, right? Where the knowledge and skills necessary, so many people already have, and we learn from you more often than not. But if there are things that we can help provide to assist you in the work, that's what we're here for. The connections in partner building is a big part of it. Building relationships, not only, I think we talked about this a little earlier, not only with other folks doing the work, but those that are experiencing it. And then tracking and measuring progress, which nobody really likes to do. But if we continually build strategies and don't know if it's working, we may or may not move the needle on some of these problems. So Sarah and I are here to assist in kind of figuring out okay, you put this out there. What happened? How do you know what happened? What kind of feedback did you get? Do you need to make adjustments? Did it work? And if not, then we shift and we adjust. We're all about emergence, right? Throw it out there, see if it sticks. If it doesn't, let's make some adjustments. So, but that also, we don't want to sit and do in organizations just spin our wheels. And I think we've done that for many years in Jackson. We just keep doing the same thing over and over again. And we all know that's the definition of insanity. So it's really about like, let's make sure we're actually being effective in the things that we're implementing. Because if we're not, then we need to kind of change what we're doing. All right, Sarah, do you want to run through that?
Yeah, this is just our quick group norms. And if you have been a part of a working group before, you know that the norm is to set some norms. And this is really just our thoughts around doing work together. And if people, the idea in an ideal world, we would have the same group of people trying to meet every month and then building relationships with each other and strengthening strategies and all of that. And so we want to create a space where all of these things are true, where we're pausing before we're saying things, posing questions, putting ideas on the table. We really want to have a space where nothing feels off limits. Like Nancy, I love that you came, I think you came to whatever meeting and you were like, listen, what even is, you're like, that was like my favorite thing ever. And I was like, sweet, let's define it, right? Like, I feel like there's no, like, if there's a wondering, I hope people will just say it, because maybe if you are thinking it, somebody else is thinking it also. And we want to also offer space to ask a question. Like if Nancy says, oh, I'm doing this intervention, and maybe Anna's like, well, oh, that's so interesting. I had a barrier with that. Like, how did you get around that? And so we want to create a space for all of it. We will always be a group that centers data collection and analyzing and disaggregating, paying attention to yourself and others, and then presuming positive intention about others in the group. Any thoughts or questions? Move
Love
along.
All good points.
Now, well, I'm like, we got to set the stage. We have a very small group today, and most of us know each other, so it's kind of easier. But I think when we get to be this huge room of amazing individuals that are trying to work together, it's just always helpful to kind of to set that.
That's
So
a good reminder in general. I just post that up. Yeah, it's good.
It is, and it's helpful to like for all of us. Me too, right? Like, oh, right.
Heck
Maybe I shouldn't be fired up immediately. I should wait and pause.
Yep.
So this is just a refresher, a reminder of our 14 root causes. And so these were all defined by the network collected all the statements, but it's from community people and themed all of the data. And these are the root causes that people say that are most pressing in the community and things that people are working on. So if you, think you have, Nancy, sorry, Anne, I don't know off the top of my head, if you filled out a partner profile in our database, it's a very quick, like public facing, your name and what you're working on in the community. And then you select one or more root causes. And it also helps us know what people are working on in the community. And also helps us know how to support. So for example, we have 4, that's not true. We have 3 affinity groups. We will have 4 by the end of the year. And we chose those based on the data from what people are saying. Based on the partner profiles, it's like, 80% of people said that they're working on service and policies are inequitable and they're trying to best support. So like, these are the 14 that were established, and also how we tie the work, right? So like regardless of sector, regardless of if you're in education or health, or if you're in schools, or if you're at the health department, maybe you're all working on building trust in the community. And so we feel like with systems work and with this collective impact model that we have, bringing people around the root cause, because your strategies are probably going to be similar. It doesn't matter if you're trying to build trust in health or in schools. your strategies are probably going to be pretty similar, or should be, right? With some asterisks around like content or whatever. But so when we're thinking about measuring and making a really big impact in the community, these are the things we center around. And these are the things that we kind of like, you might hear us try and like drill down to, right? Because if someone's like, oh yeah, I'm talking to parents, I'll be like, that's cool. Like, why? Like, oh, well, like they don't come in ever. I'm like, oh, have you asked them why? Like, oh, well, they don't trust us. I'm like, right. So like, there's always like trying to drill down to the why, and then that will help the conversation and interventions and all of it.
May I speak to that real quickly? Just everything that you touched on.
Yeah.
So to answer your question about the partner profile, no, I have not done it. And this is why.
And
Every time, no, listen, first
Oh,
of
no.
all, let me backpedal. And say these meetings in general have always been on my radar, and I have harbored some guilt because I have not participated because, and it sounds like an excuse, but it's been very difficult for me to attend this meeting due to times when it's been. And I'm literally at a point in my workflow where, not that this meeting's not important, but I can't be in 10 places at one time. So I have to, if something else is like, I absolutely cannot miss this one. And that's what has happened literally within the last year. I'm stretched very thin. So just had to just say that again. It doesn't make an excuse, but the profile component of it, I have logged in a couple of times and I feel like I'm not working on anything. So anytime.
not true, Ann. I could. Do you need me to fill that out for you? I could fill that out for you.
Well,
No,
wait. There might be so
I work.
so
You
the
gotta have
my
a session,
office-
and you gotta have
Yeah.
a session with Amy.
a few
and Sarah.
sessions.
My office
Nancy
was
is our
across the hall from
cheerleader.
her. I know these programs like the back of my head. I'm going to throw in some system change stuff that's happening.
Well, and
Like-
Ann, it might be that you're thinking, so we have like action planning. There's a whole page, and I think actually Nancy was a trooper in the beginning and really hung out with us, and like we had like an hour-long conversation about the things that she was doing. The partner profile is like quick snapshot overview. The speech you gave me earlier on like your introduction is literally pretty much what you can put there. It really is, and it's public facing, so that if I didn't know you, I could get on and say, oh, Ann Sloan works at the health department, oversees blah, blah, blah. And these are the root causes that are tied to her work. So it's not the action planning is like 201. That's like, all right, let's talk about it. What are you doing? But to Amy's point, and we're also happy, like Nancy said, I've gotten on calls with people who are very overwhelmed by partner profile, or they're like, I don't think I'm filling the fields out right. And we'll get on a call. Like, I'll do it with you. Like, we're not afraid. So
we can do it with you. Also, Ann, remember all of the stuff that's happening at the health department, it doesn't all fall back on you, right? So you can,
Oh, yes, huh? No, I'm
no, it does fall back on you. But here's the thing, right?
Not at all. Not even
Have
close.
one of your MIP staff, your maternal infant health people, have one of your staff members fill out a profile. Like, they can put their name in, and then they were like, so with the MIP program, they are working to take, social work and nursing into the homes for those who are struggling to get transportation. And so like, those are huge, right? You do home visiting for pregnant moms and moms with babies. So that is addressing, barriers that people are encountering. So you write it like, we have social work and nursing and dietitians. They go to the home to work with moms, I don't know if it's primarily low-income moms, but to make sure that they have what they need to have healthy birth outcomes. That is system change work. The lead programs, the fetal infant mortality program. So you have, bereavement, and it can just be a little overview. Like, so whoever's doing
So
FEMA
it's
can
just
write,
like a program profile,
Yes.
and this is accessible to other community partners. This is like a resource database, which I think
Absolutely.
you touched on before.
Yeah. So it's like you
and-
fill in and it's kind of like what you guys are trying to do with MIP. Not just like we provide this service, but we're trying to reach folks that don't normally have access to traditional, or need more extra support to have healthy babies and healthy moms.
Well, and that's, I think, what I'm getting stuck on, because when I'm looking at this, I printed it out so I could take notes, the flyer for today. And, you know, reading through this, and one thing that I really have wanted to work on, and I think this has been my reluctance, where I come from this, I don't feel like I'm doing anything, because I've struggled to address this issue. And I know it's an issue statistically. You know, Amy, maternal infant health is a very underutilized program in Jackson County. It's a Medicaid-based program for pregnant moms who are pregnant or have had a baby that's less than a year old. They only need Medicaid. We offer nursing and social work. We do home visiting. We help them with community resources. There's all kinds of lovely things we can do. It's very underutilized. We're seeing a significant reduction in enrollment. Why? Just everything you've been speaking to. Why? And also the data that's kept by the state that I've wanted to look at, there, when we're talking about health equity and, you know, disparities, those racial disparities pieces and all this social determinants of health stuff, there's a significant gap between families of color and Caucasian families that are enrolling in maternal infant health. Why? And I want to know these things, but I really struggle to get to it because of these little day-to-day things that I have to do in my job. So that's what you're talking about, right?
It is what we're talking about. So you would fill out a profile and you would say just exactly what you just talked about. Like, this is what our service is. And then when you get to the root causes, like, which do you want to, or do you think you're addressing, right? It might be that they have a hard time with all the paperwork and the enrollment. So service systems need to be easier to navigate. It also might be that you're thinking people don't know about your service. So you might click on that root cause. So then if you or one of your staff, you don't have to do it all. You can send staff people, and I know that they've got quotas to meet and things like that. But you might get into the group that talks about people don't know about my service. And then in that group, you might start talking about the why. And then you might find it's actually not that they don't know about my service, is that they don't trust people coming into the home because they think you're CPS and you're going to take your kid. So but that is where we would help you to say, like, let's get some of the moms that you've worked with. Let's ask them what they're hearing from their peers. What was their experience? And they might be like,
I need.
And they might be like, well, I enrolled in your program because I needed a free crib, but really I don't want you coming to my home because I don't trust it. Like, build those relationships with your clients that will help you really understand why the Black and brown moms in our community aren't using your service. Like, getting to those like honest relationship type conversations will help you. And then, you know, you're meeting your state outcomes and all that other kind of thing. But it's really, that's the point of the groups. So your profile should be simple. Your profile should be like, our MIT program does this. And then you want to work on these 3 root causes, or you think that these are the things that are hindering success in your program. And then you get into groups and you brainstorm with other people. Like, Nancy then comes in and says, we thought that too. We thought that people just didn't know about college and career access. And really what it was is that they didn't trust us to with their financial information to fill out the FAFSA. You know, like, you'll build off each other. Does that make sense?
Yeah, that does make sense. And that I think I've been overthinking it, because when I pulled that profile page up and I see, like, you know, just like I said, I feel like, well, I'm not working on anything. And it's not that we're not.
Yeah, you are.
I mean, that's what we do every day. I'm overthinking it, and then I get overwhelmed, and then I'm like, I'll do this later. And then I get another email that says there's a meeting coming up, and I never did it. So
you're like, I can't go there because I didn't do my
Sounds
partner
like-
profile.
It sounds like you're like getting really caught up in your operational pieces and you're not really able to look at it from a strategic standpoint. That's what it sounds like to me, just listening, that you're like in the day-to-day mix
every day.
But you want to come up, not when I'm using this, I'm saying you want to come up in the tree. You're down in the forest on the ground trying to make sure everything's okay, but you really want to rise up to the top of the trees so you can do a bird's eye view analysis.
That's a very good way to put it. So
and there also is a we can send you a link. It's also, I mean, it's on our website too, but you can see what other people have put in. And I feel like sometimes that's helpful because we don't really, like there's been maybe 2 people that we've asked them for a little bit more detail or asked them to go in a different direction, but really people are putting like 1 sentence or like 2. It really is, this is the overview of who you are. And if you have a colleague or a coworker, their profile should be separate and different. I mean, maybe your root causes that you select might be similar or maybe a little bit different, but it is individually, right? Because the things that you're working on, you might write, I'm supervising programs that do X, Y, Z. Like that is what you're doing. And then later, like Amy described, as we get into even like the challenges you're having around this data collection piece and this thing, like, okay, well, let's go there then. And then if that turns into something deeper that Amy and I can help you with, we can go there, but don't overthink that partner profile piece. Yeah.
Because
Okay,
you might,
I will
yeah.
get it done.
Don't,
Get
and
it done.
this shouldn't be a burden. It's really a way to connect, right? And then also,
It is.
so
And I'm
think
just overthinking it. I'm like, oh
Yeah.
gosh, I don't know what I'm doing.
no, nobody does. I know.
We
and this
also
is where
have
our jargon,
systems
some of our
change.
jargon is making
Yes.
people, it's intimidating too. So don't be
Yes.
intimidated because it's just a way for us to figure out. So, and you might have a MIP social worker that says, we actually worked really hard in this project where we translated some of our, the brochures into Spanish and made sure that we had like multiple, like, language brochures to help them. So that is making service systems easier to navigate, right? So you might have been working with the Latinx population to make sure that it was culturally appropriate for moms and babies. That person might come to this group. And then you also might have someone that's doing more outreach, like trying to ramp up MIP services. They might come to people don't know about our services, or it just, you'll have different staff that potentially could be inserting themselves into the different affinity groups. But yeah, don't stress about it. People have gotten very in-depth in some of it, and some of people have, I'm working to, make sure that people in our community have, jobs accessible, or, so it can be very simple. And I would encourage you to fill them out for different initiatives. And you can go back in and be like, wow, now we're working with the state to make sure our policies aren't inequitable and their practices. Like, so you might be doing a whole separate project with MPHI or something that you come back and say, wow, this is a project that is kind of important to us, and put in a different profile that says we're working with the state of Michigan to look at practices and policies. You know what I mean?
Mhm.
And I would say this too, and part of the nice thing about these groups that I found, or these conversations, is that it does help you kind of come out of your day-to-day a little bit and concentrate. So to have these conversations around bigger picture issues, even though you're trying to drill down, like they say, it does help you. It gives you some time to strategize, to think, so that you're actually, the time that you want can be dedicated somewhat to this, so that because it sounds like you are caught up in the day-to-day, which you have to be. But you do need time to be able to concentrate on these areas in order to move the needle. So I would just concentrate. I would just kind of come to these with that thought in mind, that you'll leave here feeling a little bit like, but you'll also leave here feeling like, kind of like you do when you go to PD, like to a conference or something, you get all this, you get your brains moving, you get your juices moving.
Well, and to your point earlier, Anne, around like schedules and meetings, like we are not trying to meet just to meet ever.
Oh no,
But also there's also some validity in like, we know that schedules are hard, and in a dream world, we would have the same people and then coming every month around this issue. And then like, so that you could say, oh, right, last month we talked about this thing, Nancy, how did it go? And then we're adding new people, and we're doing this thing, but it's hard in a virtual world. And also people are busy and doing things. And also it's still a little like, to your point, both, right? Like, well, what is the point of this? Because we want people to find value here, and we want them to be like prioritized. We want to get to this point where you're like, oh my gosh, I don't want to miss this meeting because I know that it will offer this much value, and I have things to offer to this meeting as well, right? and we're getting there. It's just like baby steps. And so, but hopefully like at the end of today, you at least understand the intent and like how we try and gather people. Nancy has offered some great explanations as well, around intent in conversation. And then maybe also there's a point where I think Amy said earlier too, where you're like, oh, I am actually like super stretched thin, can't regularly attend, but I know this person that would be really important to have at the table. They would have a lot of value. They would add value, find value in connecting with others. But we're not also like not trying to guilt anyone ever. And also really, I'll speak for myself.
No,
Well,
you know what?
I'm curious though, quickly, is there anyone else from the health department who participates in this?
Michelle does in
Okay,
different
good.
aspects. Yeah. So Michelle has
Okay.
come to some
She's
stuff.
like, yeah, sometimes.
I've
Yeah.
heard like Stephanie has kind of emailed me to say like, can't come.
Morning.
Yeah. Because I
Okay.
think she would lend a lot of insight on this. She gets like real feedback from folks that are coming in and out of WIC, and
WIC is huge.
yes.
That's
And
yeah.
also, Anne, and I'm not like throwing in a plug, but I am kind of like, I would love to sit one-on-one and like some coaching with you and like work through an action plan. Like you want to increase folks that are coming, utilizing your services. And we literally could go step by step and say, what's the data you have? Like we'd bring up Champs and say, this is it, Champs, that right?
Yes.
Yeah.
That's exactly where
I'm
it's
like,
at.
oh, remembering that. We bring it up and say, this is what the data is showing. And then we would build like some steps. So like, all right, Anne, like by 2 weeks from now, I want you to go and like meet with 2 clients that have utilized the service and liked it, and then meet with someone that only came once and got their crib and left and didn't come back. Like, so we would build some strategies into it that you could like really kind of drill into, like, why aren't they using it? What is the data shit? And we could like work through that together. So if you want, shoot me an email. I'm not pushing it, but and then
No, I think that would be fantastic because it would
if
keep
that's
me
in the
on
back of your
task.
head, I would be being like, Anne, you said you were going to meet with a client, did you? Like, I wouldn't hound you, but it would help. Well, I might. No, I think it would be helpful for you to try to like keep moving with the big picture while you're still maintaining your day
absolutely.
to
I think
day.
that's a great
Yeah.
idea.
So we can.
And we
connect there.
have, I mean, that's part of what we do. We do the affinity groups, and then also we love one-on-one conversations. And I mean, it's beneficial. It's a bonus today because we have 2 of you, so it's able to be a little bit more targeted. But when we have like a large group, it's impossible to be unique to each person, right? So the
And that's why the
one-on-one
network
stuff,
hired us.
yeah.
They're like, wait, we need some people that can help hold accountable, that are experts in the field, that can go through this action planning or strategic development. I don't know, you can call it 6 different things, but really about like, here's my problem. And then we will help build that structure around it and help with accountability. So you guys are paid for us. So why don't you use us?
Yeah.
That's the takeaway from today.
Will do. Yeah, I'll follow up with you. Yeah, for
Awesome.
sure. I think that would be really helpful. That would be, because you got to start somewhere.
Yep.
Yep.
And I think that's been, just with COVID, I work at the health department. Everything is COVID.
Shifted, yeah.
Everything's
Oh,
COVID,
yeah.
I mean, it's been, it's been a challenge. More so for others than myself, but that's a good start. So I am going to take you up on that for sure.
Awesome. Yep. I know where you
Cool.
live, so I'll come find you.
Oh, this is a
No,
new kind
you
of
don't.
coaching.
I moved.
Oh, I meant your office. I'm like,
No,
right.
I'm like, you did know I lived up the street.
I did. Yes, I did.
But
I knew where you lived.
It's
But I
like-
did move.
Oh gosh. Knocking on doors at 6 p.m.
Yeah.
Hello.
Like,
Where's
have you
Ann?
seen Ann around?
Right.
I could have moved offices.
No, I can see the setup of your office. Open the door. Can you see my office still across the hall?
It's around the corner. Missy's in there now.
She is
Mhm.
taking my space. Have you hired anyone to replace me? Because I'm irreplaceable.
No, yes, exactly. No, your
Humble,
position,
remember?
it got turned into a full-time nursing position.
Oh.
Interesting.
And
Oh,
I don't have a nurse.
yeah.
Oh.
You're not going to get one for femur, probably.
E.
Oh, I had
Maybe.
an interview. It was really successful.
Oh, good.
Yeah, I haven't offered it to her yet, but I'm just waiting on references. But it has taken a year to fill.
Wow.
So we combined the health education piece along with the case abstraction and the bereavement
Interesting.
component. That got pushed through a year ago. Yeah.
Interesting. Yeah. Well,
it's
if you need
been
any
really-
direction on that, I'm happy to come back and meet. Sorry, we're digressing.
Yeah. Yep.
Okay.
No problem. I appreciate that. Thank you.
Okay. So we'll do a quick overview kind of on what the point of this is. This is one of the things that one of the tools or one of the ways we kind of move through it. We'll get a couple of slides later into some of the stuff, but this is just kind of an overview. Obviously, engagement is always at the center. We don't want to take any step or any action until we really find out what true barriers are, build those relationships, help them be part of the, moving around. But it really kind of often starts at the top. Sometimes you'll jump into the middle of the cycle, but looking at the data, what's going on, what are we seeing, what's on the surface, like what do we see in our community that shows inequities and things like that. And then disaggregating that, drilling down, better understanding the root causes. We've got like in-depth tools for each one of these steps. And then obviously kind of bringing in some strategies, hopefully that address multiple root causes, looking at the measurements, implementing the strategies, and then tracking and reporting. And sometimes when you're tracking and reporting, you realize that none of this is making a difference, and you jump back down to the bottom of the cycle where you're like, okay, let's go back to understanding the root causes, because what we thought was it isn't. So that's just a little overview of kind of some of the ways we move through some of this, building these strategies.
We also say too, like, we don't expect you to memorize this.
No.
We don't expect you to remember the order. But it's just the framework that we've been talking about this entire meeting too, right? Like, if you're having a tough time at this step, it doesn't matter, any of the steps, that is what Amy and I are here for. Like, I designed this powerful strategy, but actually I'm not sure if it's making a difference. Or we put this thing in place, this is my problem, we did this thing to make a difference, but it's not fixing the problem, right? So like, just so you know, this is our framework when we're asking you questions, and this is how we kind of operate and move. And there will not be a quiz later, you don't have to remember the steps, but this is to
the
Amy's
general
point of like,
process. Yeah.
yeah, we'll never say like, oh, well, you should do this exact intervention, because that's not our job. It'll just be like, oh, well, have you thought about, did you ask the community about that thing? Oh, like, well, tell me about the history. Because the idea is that we're going to ask thought-provoking questions in this framework to help you come up with the answers. You should be like, actually, I did not ask the right people. Can you just pause? I'm going to go ask the right people, right? So like, that's the goal.
Okay. So
You want me to put a link in?
yeah, yes, please. So we have a Padlet. Think we've worked with these before, and this is kind of where we're trying to find out what you are all doing in your organization around making services, or what you would like to do around making services systems easier to navigate. So Sarah put it in the chat, open the chat. If you copy and paste that into a separate browser, you can bring it up. And let me see if I can bring mine up. And that way we can, and you know what, we don't have to actually use this Padlet if it's difficult, because we have such a small group today that we can kind of talk through it.
I did
But-
put earlier, it's also a way for us to capture maybe some of the strategies that came up today or the conversation. So I don't know if I captured it well, but I thought that the conversation that Anne talked about earlier was an important thing to capture, and not necessarily like, is this a strategy, but I didn't want to lose it. So I'm also open
We
to
sometimes
typing
note
it.
take on here too. So you guys are
Yes.
welcome. There's a pink button on the bottom right. You're welcome to click that. It is real time, so it will come up on our screen as well. We will not judge misspelling or any kind of grammar, because that's not what we're here about. But so it's really kind of like, so Nancy, if you got something going on in College Career Access that you felt like was really complicated, and so you implemented this thing to say, okay, students weren't filling out the FAFSA because there was whatever might have happened. We are trying to find out, what are people doing? Like, we know that the center might be trying to take out some steps, and we know DHHS did a complete overhaul in trying to make their things. So we're trying to, in these meetings, find out what are people doing, and be able to compile it, so that when someone else comes up from community action agency, I can be like, oh, the center worked on this, they already did translations, so let's connect you with them, and then you can build off of that. So
Right.
Sarah can also, she's the guru, the Padlet guru. So if you want to talk through things, or if you're thinking of things that you have done or want to do, she can kind of input too. notes on there.
Since there's 4 of us, it'll just be easier for
Yep,
me
let's
if
just
just
speak it.
talking through it.
Yep.
Mhm.
But one of the huge areas that we've been working on are the class of 2020 and 2021 in terms of there's a large decrease in enrollment for these classes due to the pandemic, and also a large decrease in completing the FAFSA. So we've been working on specific strategies around those 2 classes, and we know that the root cause is, well, because of the pandemic. Folks haven't been coming out. They haven't been having conversations. This is national, though. This is a nationwide problem. They haven't been, they haven't had the interventions and supports like they have within the schools to actually be able to help assist and support first generation students, low income students, and students of color who are low income and first generation that are built into the systems around the nation with college access. So what we've done is we got a grant. It was a short-term grant through the Kresge Foundation and the National College Attainment Network, and it started in April. So we administered our senior exit survey. So that was one strategy in terms of getting feedback from the students. We found that about 22% of students, COVID did change their plans. The number one reason why students feel that they can't, that they cannot go to or pursue post-secondary education is because they believe they can't afford it. So that's still the number one reason, even with COVID, and that hasn't changed. That is the number one reason year after year after year, is because they don't think they can afford it. And so we did the advising, or excuse me, the senior exit survey collected our data. We recruited a team of impact advisors, near peer advisors who had just graduated from the class of 2020 and 2021, who joined our team over the summer. And we hired on two of them for continuing purposes. We went out in the community instead of having it just be at the center this summer. So we had FAFSA food trucks.
Awesome.
Yeah. We were able to go back to our, what we call boots on the ground, which is something that might be really interesting for you, I think, Anne, when you talk about your maternal infant health program. With our boots on the ground, we piloted this about 6 years ago. And basically the goal was to take our services door to door with our students, with our most at-risk students. And we've scaled it up every summer since then, and we just made it a part of our general budget, but we were able to return to that this summer. So we literally knocked on 138 doors this summer and had 63 conversations in homes with people or on their doorstep or with our students. So that was another strategy. And then, so the impact advisors, the FAFSA food trucks and informational events, and then the boots on the ground were 3 of our largest strategies. Now the near peer worked really well because people want to hear from their peers. It's cooler. I mean, they had like a lot of traction. The outreach services, they didn't go, the FAFSA food trucks did not go as well as we had anticipated. We thought, we go set up shop, we promote it. We think we probably had too many of them. So
why would that, so too many so that they didn't pay attention to it because it was too often, or
just confusion on like where they were, when they were. We're not totally sure. We just know that some were well attended. We had 93 folks overall attend those. And I want to say, I'd have to look it up, but I think we had 12 events. So 93 people for 12 events is not, it's not great. It's decent, but.
Yeah. And so of those, do you know that they connected and filled the FAFSA out? Like, do you know what outcomes came from those?
Yep. We tracked, we were able to track overall our FAFSA completion, and we did have a 8% increase over the summer, which is huge for us.
Did you look at whether it was like a certain population that hadn't, like, were you able to engage in a different way that built, say?
We're not able to disaggregate.
That's what I'm wondering.
We only can look at the aggregate per school district, but we can't disaggregate by low-income students of color first gen. We do get self-reported data on that from the senior exit survey. And one of our at-risk factors is if they hadn't completed their FAFSA yet. So we're going
You know
after.
that. Yeah.
So anyway, we're actually just writing the report on this grant, the final report, what worked well, what didn't. And I would say our best strategy were that we engaged in, well, there's two, the impact advisors. That was a wonderful strategy. And we're going to continue to do that every summer. We're going to engage. So when I'm thinking
Awesome.
about yours, Anne, I'm thinking about maybe using people that have done maternal infant health before, like your alum. If you could contact with one or two of them, maybe provide a stipend to have them reach out to, I don't know. Do you get referrals from Allegiance on people that are on Medicaid and need assistance? Like I'm thinking about the early on program and I'm like,
It's similar. Yeah. In concept.
yeah, like unless somebody
I
tells
oversee
you,
that too.
you
Yeah,
oversee early on.
Yeah.
yeah.
Okay. See, I'll tell you what, I had early on for my daughter who has hydrocephalus. I would have never known about early on if the people at the hospital would not have told me about early on. So there was a disconnect for me back in the day on that. And then I also was under the impression, they gave me the impression, that it was low income, but there was a sliding scale. And I have one of my team members that I referred to your early on program, and her husband's a doctor. And she said it's the best thing she ever is. Thank you, Jesus. Every time we have a touch point, she's like, I cannot tell you how much I love early on. The speech therapist, the physical therapist. I mean, she's like crying almost, but she wouldn't have known about it. So I'm thinking
Or there's a misconception about it that it's only available
Well,
for
it
low income.
sounds like there is, because early on does not charge fees. It is a free assessment, and it is not income based or anything. I mean, disabilities and developmental delays don't have any boundaries in terms of anything.
But what about
so that's
the
interesting
interventions?
to hear you say that, because
I
there's
have heard
no
that
fees.
as well. I have heard that as well, that like early on is for a certain population, and that some people would not qualify. Mhm.
Well, they may not. There has to be a 25% delay in the domains that we measure. However, if there's an underlying chronic health condition, prematurity, or substance exposure confirmed at delivery, those are automatic qualifiers.
like, I think about your piece. I'm just like really diving into your piece because
I know this is all really good feedback.
Yeah.
I valued so much what you provided. I cannot tell you. I think everybody should know about it. So a couple different things I'm thinking about just overall is the communication about what you do from the providers at the hospital. So maternal infant health, I don't know if it happens in utero or after the baby's born. I don't know anything about it.
It never happens, because we get 0 referrals from our OBGYNs in Jackson. 0. Why?
Okay, but why?
that's another why.
I mean, you think about the pharmaceutical people. They are pounding the pavement while you're in the waiting room. They're coming in there and talking about, I got this, I got that. You got to have somebody pounding the pavement, going to Dr. Pastoresa's. I know Dr. Pastoresa's got a ton. I mean, he was my doctor, and saying, hey, this is one pager. This is who we are, what we are. Refer people to this. I mean, you almost have to be like sales oriented.
The staff doesn't know about it. And every time I'm in an OB-GYN office, or even I just did a presentation for a peds office, and they were like, we don't know what to do with at-risk moms. And I'm like, I do.
Well, yeah. Are you still working on that lunch and learn that you emailed me about? Because I'd be more than happy to come and present.
I was, but she cut my time to a half an hour. So I did more about infant mortality disparities and empathy training. So, but I do want to follow up, and I also want to do the Women's Health Center. So I might come back, because that was one of the things they specifically said is how to identify high-risk moms and then how to support them. And I'm like, I'm going to bring one of the people over and have them talk about it.
But I would think like you could create like a pillar of communication, and then under communication, you could have 2 strategies. Reach out to have alum moms, reach out to new moms, and then number 2, have this many doctors be reached by our staff marketing what we do. And then a third one, have this many referrals, have a goal of this many referrals from that second strategy. So basically 2 strategies under communication. And then I would think that you could develop something else because it sounds like you don't know why there's a decrease, but you could do, I'm just thinking about what you could do. Another thing that I feel like I have to say this, and I could not believe this. Zoe invited me like 2 years ago before the pandemic to come speak to her staff about TIP. Our TIP, it's a free scholarship for any student who's been on Medicaid for 2 or more years since the age of 9.
Mm-hmm.
She had a staff of like 150. And when I asked who knew what TIP was, 2 people knew what TIP was. So like if the people that are giving Medicaid out, this is my whole thing. I mean, I know these workers have got to get the application done. They got to get it processed. I know that they have a lot of different outputs that they have to take care of when they're interviewing, but wouldn't it be cool if right there they said, and FYI, if you're on Medicaid, you can be part of this maternal blah, blah, blah. And I don't know the name, sorry.
Yeah,
and you could also, when your kid turns 18, they would qualify for this scholarship. Like, I'm like, everybody take a flyer and tell your people about it when they apply. Like now that you know, pass the buck and let them know.
That's huge. I mean, and that's that relationship building too. But in DHHS, I know has really high rates of turnover, right? So I've done presentations for them. I'm always baffled at, but because they're new and, and they're 20, right. And so they turn over so quickly, and you got to go in every, like Nancy says, hit the ground and show up at these places, because that will make a world of difference. And if
I remember you saying that, Nancy. I think you told me before about the TIP thing. And I think there is a piece in there too, right? When you think about like systems level work and change, is there something that like, so like if odds are high that if you qualify for a TIP program, you might also qualify for this thing. Also, here's a link for this thing that you might also need, right? And so there's like Amy said, a relationship building piece, but that also speaks pretty clearly to all the service systems are difficult to navigate, right? Because if we can have one person, if there's a person that comes in to see Anne or one of her workers and is talking to them about things, like, right, even trying to navigate systems for a lot of people is really overwhelming. So wouldn't it be handy, I don't know, if a flyer, I feel like we do one pagers for everything, right?
Mm-hmm.
But like, isn't like, maybe there's a list of resources, maybe there's a way to say like, here, connect with this person if you need help with tuition, or if you need food access, or if you need health or whatever. I don't know. Maybe something already kind of does exist, but like when we talk about accessing things, right?
And Anne, that brings me back to thinking about the Care Hub, right? The work that we did with the Care Hub, so that once, something, they went through the social determinants, things were identified, and it should pop up and do some referrals. And I don't know where
just
that's
as
at.
My Bridges.
Yes.
It's, the My Bridges has that whole community partnership relationship. It's as good as 211, just like the hub, where it's supposed to, do that social determinant of health screening. And in the My Bridges application.
And that doesn't generate referrals?
It's only as good as it's accessible. And when you can't access it or don't know how to access it, which I recently just learned how to do. So it hasn't been helpful to this point.
So that would be good feedback to come back at it. Like, why are we building these things if they aren't working? Right. So where we should
but
identify,
I'm making progress on that, because I have reached out to the state.
Okay.
So there's lots of all these little components, but these are all really good ideas. And really good feedback. I'm curious, Nancy, you're mentioning of kind of that grassroots, boots on the ground, knocking on doors. How did people feel about that? What was the reaction? What was the response that you would get from people?
Overall, it's positive. There's only been probably, I'd say, of the 100% that doors he knocked on, probably 15% he's got like, no, don't come to my house again. But Brian Green, he's been with us. He's in his 7th year, and he's the one that has always done it. He feels very comfortable interacting, socializing, knocking on doors. Even, I said, "Are you ready to go back after we're still in a pandemic?" And he was. So overall, it's been good.
Good.
He is Hispanic American, self-identified, and so sometimes we have another staff member, new team member who's African-American male, and he went and shadowed with Brian. And there were some times where he said he would not have felt comfortable in the way Brian has going to certain doors, just because he felt that they might think he was a threat or something of that nature. So we were trying to, create a feeder for this piece because it's really important. But people want to talk. I mean, they want to know, we have this, they want to know what's going on. I mean, from our perspective, that's what we found. They want to help their kids. They want to help their kids. It's just how to go about doing that and having the information available. He completed, I don't have the numbers in front of me right now, but he completed a number of FAFSAs on people's front porches and in their houses.
Wow, that's
Wow.
incredible.
Connecting to a hotspot, boom, right there, like connecting their
How
Wi-Fi.
cool
boom,
is
right
that?
there.
I mean, and
Right.
that's what this is all about, in reaching those people who otherwise may have not had that available to them. He's right there and he did it. That's awesome.
Yes, we were super excited about that, especially this summer. We were like, man. So yeah, no, I think that you have a lot of education to do and communication that could happen with just some really small strategies, but you have to have somebody that can do that work. I don't know if you have somebody that you've hired or you could delegate that to them.
Well, and if they don't have full schedules, I mean, I wonder if you build that into some of their work plans, that like they need to dedicate 2 hours a week to hitting the ground.
Working on that.
Yeah.
Got a
I
meeting
mean,
next week about it.
if they're not,
Yes.
if they don't have jammed schedules or appointments, then throw it
Yes.
in and say, schedule in 2 hours a week where you are either meeting with a physician's office or an office manager, or, down in the trenches, like knocking on doors. But like they could do both. Some might be more comfortable talking to professionals and some might prefer to connect with individuals, but that could be built in on a weekly, that they need to meet those 2 hours and report back on them.
Yeah, no, that's
Even get a list of all the practitioners and divide them up among your staff and have their goal be like, okay, your goal is to hit 12 practitioners this month, either via email with the information, do the one pager. Cause I don't know what it is. I have no idea until you just said what that was. Now I can tell. I have a mom right now that I'm working with, Jabaria. Oh, I shouldn't say her name, but she'll need your help. She will need your help. She has
Yeah.
a
and we
1
would
month.
love to help her. Yeah.
Yeah.
They have
I
so
mean,
many resources too, and so many supports in that program. It's amazing. And they will come to her and they will lift her up and they'll connect her with what she needs. It's awesome.
And right now with, we've got this emergency order. Medicaid has approved telehealth. So we're doing a little bit of both right now, because until that emergency order is lifted, we don't have to be in the home. But it's certainly encouraged as long as it can be done safely. In the home, we are doing that as well. So, but yeah, I'm right there with you, Amy. We've already got a meeting scheduled next week to talk about that. Like
Awesome.
so we've got some things in place. So the more I hear this and the more I talk about it, it's not that we're not doing anything.
right.
It's just, we've got some things in motion. So this helps put it into perspective, but that's good. Now, I'm thinking like incorporating staff into this as well, and having some membership and ownership, because this is a collaborative effort amongst our team. It's not just siloed to one individual person who's responsible for this. If we want to be successful and reach those who need us most, we've got to work together to get it done.
I also think, Anne, they'll add such value because they are boots on the ground. They interact with women and they can give folks in the group some like real feedback about, what they're hearing and what they're seeing. That's a secondary or a bridge to engagement there too. And if there's stuff in the group that people say, I don't understand why they're not using such and such service, like your home health workers can come back and be like, I actually asked 3 women and this is what they said. You know what I mean? Like,
I will say, Anne, when for that grant that I wrote, before I wrote it, I went to my team and we had I said, we got to do a brainstorming iteration session. So we took 45 minutes, sat down, and I said, if you had all the money in the world to connect with class 2020 and 2021, what would we do? what are some things that we would do? So they came up with a lot of those ideas. And then I just wrote the grant, and then I wrote the grant. So, I think that there's merit, but you have to keep them on task. You have to keep them in direction when you're asking those questions. Because otherwise, man, it can go left field, right field, blah, 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 blah. And you're like,
Right.
focus. How do we communicate?
Right,
How do we
right.
get more people?
Yeah,
So
we
you're
go down rabbit holes real
valuing-
quickly.
I say that you're valuing and listening to people who know, like, that's impressive.
Yeah.
That's
Oh, thank you.
to me, that's a sign of a good leader. I'm just
Yeah,
saying, like, a lot
100%.
of leaders, bosses think that, like, I got this shit figured out. That's more,
No.
but
Oh,
like,
no, yeah, it don't work like that.
Yeah.
but I think that speaks to a lot of, like, hey, you guys are out there. Let's do this together. Let's bring our brains together and all bring our strengths together. What does that
We all
look
have a
like?
talent.
Yeah.
And I think
Yep.
we've talked about this so often, but system change work happens best when people have humility. Like
Yeah.
you can bump up the services that you have all the time, but until you are humble enough to say, maybe we're doing it wrong, maybe we're not meeting their needs, maybe we need to change our style or whatever happens, it takes humility and it's hard.
Or what did we do well and what did we not do well?
Yeah.
I mean,
That's
that's
right.
what the
Yes.
questions we always ask ourselves that as a team. Okay, what went well? What could we have done better? What
Right.
is it that didn't work? And it's okay to say
Yes.
what it is that didn't work,
Yeah.
because it
It's
all doesn't work.
critical, right? Because we're
Yeah.
not going to make adjustments until we say that.
That's right.
And I think it's important to help, like our teams understand these things take time. This
Yes.
is not going to happen overnight. Baby
Baby steps,
we got to measure our progress and see how we're doing. And we don't have, and as cliche as it sounds, this magic wand where we can just fix everything and we can have answers to all of this. There's got to be effort put into this and to answer these why questions. So having that discussion, like, we understand this is a timely process. So, we're all on the same page. So that's really helpful.
I think that's
yeah.
I think that's a great point. And to be honest, all of this work is, right. Like, even our attempt to gather busy people together to try and do this work, like, but think about how rich and lovely the conversation has been today. And like, that's a movement forward, right? Like, so like, it's happening slowly, but it's also happening. And I think it's authentic and in your organizations as well, right? Like, a small step is still a step. Like, I am all in for, like, let's change the world. Like, I'm absolutely that person. And also the reality of, if you're in a system and like an organization, and especially if you're both in like leadership positions, moving the needle is like tough. And also small moves are sustainable and also a reason to celebrate, for sure.
Mhm. Absolutely.
All right. Are there any other strategies that we're missing that you guys wanted to share and did Sarah capture the notes? No dig on you, Sarah, but were there things that you felt like you were doing to navigate, to make it less difficult? Like, because we're trying to we have these amazing rich discussions, but we're trying to really mold these into, like, yes, this organization, these are the 3 things they're doing around it. Also, when we do a follow-up email, feel free to 3 bullet points back. Like, if you feel like these are the 3 things that we have done or are doing around navigating service systems. We're trying to get a little bit more in between these meetings because these are amazing, rich discussions. But Sarah and I sometimes have a hard time capturing actual strategy work. So we'll probably do a call out after this meeting to say, did we capture it? Like, we'll start kind of translating some of the notes you took, but shoot back. Yeah, these are 3 things that college and career access are really doing around making it easier. So system work in general, but related to, we've done this, we've changed this policy, or not policy, but the way we did this so that people can access it. And like Nancy, one of them is that door to door with a tablet so that they can fill it out right on their porch. That is a system change thing that is making it easier for them to navigate that service system.
Yeah, that worked.
Yeah.
Because the FAFSA food trucks,
Awesome.
we would not do again. It was too.
Oh, that's a great lesson learned. So to me,
Yeah.
when you're
Yeah.
collecting data and sharing it, right? Like,
Right.
Yes.
Yeah, I think that's
And in
great.
these groups, like this is where we wish we had 30 people in this group, because someone else might be like, we're going to go down to the community fair and put up a food truck. And you're going to be like, no,
Don't do
you know,
12.
like, no, but seriously, like we need to learn off, like, why keep reinventing the wheel? If you've tried it, you
Right.
can share that, like that wisdom with the next
Right.
person.
Yeah. Yeah. And when we went to the bigger, like the community, they had the, God, what was it? I don't know, they had something all summer down at the
Southside Summerfest. Yeah.
Southside Reunion. We set up shop there one time, and, we had people come, but the ones where we just set up, free for all, no,
Not
we
so
won't do
much.
that again. Yeah.
That had to have been incredibly costly.
Well, we had $100,000 grant for a 9-month grant. So,
Oh, wow.
yeah, but it was like $500 a pop. It wasn't too bad for 30. We ordered 30 meals, pre-ordered 30 meals. So $500 a pop, and we had 9 or 12 events. So
That's way less than I would have anticipated.
Yeah, me too, same.
yeah. And I think that if you do it in the right, like I said, if we had to, like, literally, I wrote the grant March, we got the grant April 1st, grant started April 15th. So it was a super accelerated grant. I mean, we had to, but we had it all laid out very nicely in the grant. So it was good. We knew if we got it, what we would do. So anyway, it's been a whirlwind is all I can say. Well, we have other things I can talk about too, aspirationally. We're trying to, and I believe this too, Anne, is that you got to let people know about this stuff early. And I'm all about, I think that religions have it down very well, evangelizing the kids so they can go to the parents, whether it be, Muslim, Judaism, Christian, I don't care what. The best way to get the information is to get it through the kids. And so I'm all about aspiration and really informing kids so that they know and they can spread the word to their families. So one of the things that we want is we want 100% access to our career initiative programming pieces in the summer, which are basically robotics and college and career curriculum at the aspirational level. So we really wanted to see that happen for all students to be able to have that enrichment with STEM. And so we were able to collaborate with the Jackson Community Foundation and ShopRat Foundation. And ShopRat Foundation is right now going to be offering robotics in all 13 districts at the elementary level. So we're championing that effort. We're not providing that direct service, but we're super happy to be a part of making the introductions and the soft handoffs and really laying the groundwork for ShopRat Foundation with our districts so that they can really go in and have 100% access to all students for robotics. And we're piloting it in 4 districts right now. So I've been having a lot of meetings. Thank God for Zoom, but really to make sure that handoff and the overview of the program is understood by the superintendents first, then the principals, and now we're at the meeting level where now here's ShopRat, and they will now run with it with you and your point person at your schools. So we're super excited about that. But I think that looking at what you're doing, it has to start too in the schools. That's a whole nother level of communication you could hit on for letting people know about your program, like going and having whoever your outreach person, going to your alum, going to the practitioner, and going into the schools.
Yeah, I mean, yeah, you think about all the nursing programs and all of the, when I used to do presentations out at Jackson College, with some of the, when I did infant mortality and safe sleep and all that, talk about it during those programs, get them when they're young so that when then they get into whatever they're doing in their career, yeah, then they'll know about the program and we'll be able to distribute that. Okay, so we captured probably most of it. If we didn't, reach out to us, but I think we're going to try to start compiling things that are going on. Let me see if I can get out of this. Just so that we can see that we are building momentum around it. I'm going to run back to my slides here.
Oh,
I think I'm off here. Where were we? there. And here. Okay. And I just want to run through, I know you guys have to probably wrap up soon, but I want to run through some of what we talked about at some of the other meetings, just to recap, and if there's any updates or things. Sarah, did you? So
Capture? Did I do it?
no, I was just going to say, did you want to touch base on any of the things that we talked about in some of the previous meetings? Just so
Oh,
that we
yeah,
can-
these are, and we're really, like Amy said, we're kind of building this as we go. And so as people are attending and we're having these rich discussions, it's just tough because we know that not everyone can come the next month. So ideally, in an ideal world, next month we would have this meeting, you both would be there and then other people too, right? And we could be like, Anne, how did that, and maybe even in between now and then, we also have contact with you, right? Like, here's what we talked about last month. Anna's working on some outreach for a blah, blah, blah. Nancy's doing this thing. And then we are going to we're going to take our strategies and put them in a thing. That's what we're going to do. We're going to put them in a thing.
I'm not sure what thing, but
It's the idea is that then we can show what we're doing, like Amy mentioned earlier. So these are just some strategies that other people had shared on what they had been working on. And I don't know, like, I know one person like hasn't been able to make it back. So we're still kind of figuring out how to build this thing where we can follow up and to be honest, so we're working, but this is what we talked about last month. A lot of like turnover stuff and barriers on staff stuff.
ideally, once we start writing some of these strategies down, like we're working on building feedback loops for the board to hold the state more accountable, like ideally, we would be able to reach out to the folks that have come to this group and say, hey, how's that going, by the way? Are there any updates? And then
Yeah, and I've already seen 3 that I like just from that and the other thing that you put out there. I've seen 3 that I want to connect on. I liked the oh, where did it go? Oh, the one back. This the computer system. I just had a meeting right before with you guys with someone in Ohio about a case management system that we're looking at. And then this registered apprentice training and careers, clear, more simpler, transparent for a pipeline. We're constantly like trying to figure out how to do that. So
Yeah.
I don't know who the 2 people were that did that, but I'd want to connect with them.
I know Bill Rail
yeah.
is one. He is
Okay.
he is such a gem to have attended these meetings previously, but he's talked a lot about how the people that tend to register for their programs are usually young white men. And so like, how are they what steps are they taking to, and why don't they have more diverse people in their group? And so learning the why, and then working on how to, if it's a barrier to understanding the process, is it that, so, so that
Because
is
the
for sure.
pipeline sucks to apply for it. It's not, it's another, it's the system sucks.
Yeah,
to
it
apply
does.
for
It does.
And register. Oh my
And we'll
God.
full circle.
And yeah, you don't even want to get me started because they're crying and whining about, we don't have enough, but then they don't illuminate it. It's not a prescriptive way. You call one union, they say this, you call another union and they say this. And then, you send them over there to pick up an application. It's closed. I mean, it's unbelievable. It sucks.
Well, and to this point, like, and so I think it would be great to be able to, because as we're gathering people, and if they're not coming, right, like, can we gather strategies, put them together, ask people the status, even maybe regardless if they're able to attend, right? Because even your input on other people's strategies is great. Maybe you end up connecting with Bill and he's not even here, so all of those things are bonuses.
Yes, and that's the intent. So hopefully we'll be able to start kind of culminating these as they go along with the contact person. So both you can make contact and then you can, build off of each other, ideally. All right, we need to run through a couple of these real quick. This is just, so we will send out the action planning worksheet. It will look like this. We talked about this talked about that, the action planning cycle. And this is a worksheet that, here's a better view, that will ask the questions on how to kind of getting to do that. So it's really helpful when you just start out with your problem statement and we can help walk you through this too, but these are kind of the questions that you need to ask yourself as you're walking through it. So we'll share that action planning worksheet so that you can just start filling it out. And when you get to like the third step and you're like, I don't know how to, measure this, reach out, we'll kind of get you moving through it. But it's kind of like building that action plan that hopefully will be helpful as you're kind of coming up with some of these strategies. And then, so ideally, as we move forward, we'll have an opportunity in these meetings to do like, hey, and as we compile the strategies, this was a win for us, this was a barrier for us. Food trucks didn't work, but this intervention, the boots on the ground, when we knocked on the door was amazing. We got 4 people to fill out FAFSAs. So this will integrate this moving forward on being able to, and it happens naturally, but we really want to intentionally call out those small wins because we know this work is super overwhelming and we know that we need to celebrate the small wins or we'll quit. No, we won't quit.
We might.
Is there anything you guys feel like you want to call out at this point? I know we did a little bit already, but
I think it was good. Good conversation.
No, this was really helpful. Yeah, this was very, very helpful.
okay.
Got
So
my brain spinning.
Yeah, I know. I told you.
Nancy
no.
warned you.
No, and I knew exactly what you were referencing too when you said that. I'm like, nope, I totally get what you're saying. No, but this is very helpful. This is very good. And yeah, so I appreciate the time and the discussion.
So the next meeting's on the 9th at 12. If you guys would like, we can put you on a recurring meeting. Like if you feel like
11/9.
Yeah.
Let me just.
And
Okay.
we
I'm
will
on
send out
vacation.
emails.
No, you're not
Ooh,
allowed any
you
time
can't
off,
take vacation.
I'm on
unfortunately.
And
vacation.
you need to save the world. You can't take vacation.
How dare
On
you care for
vacation.
yourself?
Maybe, well, okay, I'm just writing it down.
Yep.
Well,
Right
I
down. And
will-
we'll email you too, because that's what we do.
Is it
Right.
always the second? Is it always the second Tuesday of every month?
Yes.
Yes. Unless we have people that like Anne, unless people start saying, I actually really want to come to this, but this is a horrible time. We're open to suggestions. We literally just took a day that doesn't seem to have a lot of other things, but if people push back, then we're open.
And we'll change it.
If I know that, and now that I am hearing that, I will be more mindful of that. Tuesdays are usually pretty good for me.
So
Sometimes.
feel free to request a recurring meeting invite. We can put that on, or you can do your own unofficial one so that you won't be held accountable to us.
We
But
do have an Outlook meeting that we can
Yeah.
add you to if you would like to be. Yes.
but also
I'm gonna do my own reoccur meeting
Okay.
if that's okay.
Perfect.
Because
Yes,
Yeah, me
whatever
too.
works.
Yeah.
And then we will be always sending out where you can just register as we send out the emails,
Okay.
either through the newsletter or through our reminder emails. So know that we will continue to hound. Tomorrow we have a coffee connection. So if anyone is asking about what's going on with the network, what are you guys doing? What's it all about? A little bit of like when we first got on the Zoom call, we kind of talked about what the intent is or how we're trying to move. If people aren't getting it, if they have questions, they have criticisms, they don't need to get on. No, but actually I do want to hear that. Like have them get on and be like, listen, the way you guys are doing this doesn't make any sense. It's not working for us, or this can better support us. So that's just an open space where Sarah and I hang out and can answer questions and have conversation, because we're not having those, hang up your coat on the way into the meeting conversations. So we're trying to open spaces for that. So, and then these are the next other, so these are the other, so this was the navigating service system. And then there's also, these are all recurring, but there's the building trust affinity group and then equitable policies affinity group. So if you've got folks that are in your organization that they're really like trying to build relationships with community members and they've found ways or things, send them to it. Like it doesn't have to be you going to all these meetings. If you have board members or people in your organization that are like assessing policies or practice in your organization that might be inequitable, send them to that one. So there's different spots for different roles in your organization and these meetings. But those are the other two, and they're in our newsletter as well. We will also forward these slides along. So I think that's it. We will have we'll send out a survey because we want your feedback. We will continue to adjust as you guys need and pivot, and hopefully, let me actually trying to find this survey, pop it in the link.
I would say just real quick feedback that it's great that you guys level set all of both of us. But if we come together next time again, then you don't need to level set. We can just go into the conversation.
Well, this is our frustration
You're-
because like
yep.
Anne's
Right.
first meeting, you know what I mean? So it's really,
Yeah.
yes, we did too much intro. I appreciate that. Yeah.
Well, I wouldn't say that. I mean, I'm glad Anne, I'm just saying like, next time when we're together. If it's
Yeah.
No,
me
you're
and Ann, we can
you're
go,
ex-
we can talk strategy
You can
again,
talk-
girl. We can talk
Yes.
strategy.
No, but you bring up a good point, and that's the whole thing. Is like if we have a new person, the intro is going to be like this, right? Because we've done it, and now we're moving forward. Yeah.
Yeah. No, I
exactly.
appreciate that, Nancy, because
Mhm.
we struggle with that. I'm like, I don't want to start over because it's really gonna. I would stop going if I kept hearing that intro over again.
It's counterproductive for
Yeah.
you. I mean,
Mhm.
yeah. Yep.
So that's actually an accountability piece. If you guys don't show up next time, we're gonna have to start over. So you better show up.
Yeah.
Unless you're on
Can't
vacation.
be at the next one. I have the MCAN conference. I won't
Great.
be
We're
here.
gonna be starting all over again. Thanks a lot.
Yeah.
And the
Sorry.
meetings are at noon, right? Noon to
Yeah.
1:30,
Yeah.
second Tuesday of every month. Okay.
Mhm.
Okay.
The survey's in the chat, but we'll also follow up with a follow-up email with the slides, the survey and all that good stuff. So, well, thank you
Okay.
guys. I really appreciate your
Yeah.
time and
Thank
I love the
you.
Thanks for your
conversation.
time.
Yeah,
Really
thank
appreciate
you.
it.
And
All
Amy,
right.
I'll be in touch with you too.
Sounds good.
And
That's perfect.
Ann, email me. Do you have my email? Because you can email me about the meeting and the presentation to your staff.
Yeah. I'll email you. Yes, right now. What's your email, please?
It's Nancy, Nancy, at jacksoncac.org.
Nancy.org. Nancy at jacksoncac.org.
You got it.
Awesome.
Cool. Thank you.
Thank you
All right,
guys.
All right,
you guys.
thanks.
Bye.
All
Thank
right,
you.
bye.